Hello, everyone. My name is Laura Poci, and I will be talking about my proactive health communication campaign in DNPU 705 Health Communications class at UMass Global. And I'm a doctorate student. And my campaign will focus on reducing against medical advice discharges among low income urban communities in Pierce County, Washington State, specifically the detox patients from alcohol. So, what is the problem we have going on? So we do have a high against medical advice rates among alcohol detox patients in an inpatient psychiatric hospital, right? So um, at least 500,000 patients who request to live against medical advice discharges later will suffer from high mortality and readmission rates. This presentation, of course, we're going to dive into against medical advice discharges among alcohol detox patients in Pierce County specifically, with a focus on the low-income urban communities. What is the theory for this campaign? We're going to use the health belief model. And the health belief model does emphasize the significance of making individuals aware of the severity of against medical advice discharges. So those individuals would be the patients that are coming in for alcohol detox and the healthcare professionals or providers that are taking care of these patients and helping these patients in the setting in inpatient hospitals. All right, so where is Pierce County? So Pierce County, just an overview, is located in Washington State, and it does cover, of course, rural urban areas with a very diverse population. I do believe Pierce County is the most diverse county in Washington State. It is the second most populated county in Washington with approximately over 900,000 people. The problem we have in this county is that about 13% of the same population in Pierce County, they do live below the poverty line, with a very large portion of living in urban areas. And with urban areas, there is little or no access to care. So this population is greatly vulnerable to risk factors such as what? Such as alcohol complications, access to substances, polysubstance abuse, withdrawals, dependence, overdoses, and sometimes mortality in these settings, and sometimes medical complications with chronic medical issues. So hospital readmission rates are higher among this community since they have lower adherence rates to medical services and or medical advice and access to care. So a research was done by Patel and Rasgadar in 2018, and that research did show that there is higher against medical advice discharges among alcohol withdrawal patients in low-income urban communities and other areas in Washington state. So it is a problem. All right. So our health risks and crisis, right? So we are going to talk about alcohol detoxification in a medical, which is a medical process for individuals struggling with alcohol dependency. Nevertheless, a significant health crisis emerges due to high against medical advice rates among alcohol detox patients. So it is a medical process, and we do have a higher rate of against medical advice discharges in these patients. So leaving the hospital against medical advice during detoxification process might lead to severe health complications such as what relapse, dangerous withdrawal symptoms such as delirium tremor. Sometimes patients even have seizures, and of course, some patients will die from living against medical advice while in detox or in withdrawals. So the challenge we face by alcohol detox patients are increased by socio-economic factors prevalent in low-income urban areas. That still ties into that low-income communities that live below the poverty line of about 13% in the state of in the county of Pierce in Washington State. Right. So according to Collins, factors such as lack of stable living conditions. So most of these patients are homeless. They have nowhere to stay. They live in shelters. They have, the lack thereof of healthcare support and access to consistent healthcare makes the recovery process very hard. And a lot of times these patients will give up and then will live against medical advice. This situation endangers patients' health while straining the healthcare system with higher emergency readmission rates, because we do know that a lot of times when these patients readmit, um, they were more acute and more complicated because they do have the acuity goes up as you know as they continue to readmit into these facilities. So the acuity is up, and of course it does increase cost as well. So how are we going to apply our theory? So for us to effectively address the high against medical advice rates among alcohol detox patients in Pierce County, low income urban areas, we will use the held belief model. And I did talk about that briefly earlier. So according to Jones, right, the held belief model holds that messages attain optimal behavioral change if the target perceived threats, barriers, benefits, and self-efficacy. So most of these patients underestimate the severity of alcohol withdrawal symptoms, or sometimes they overestimate barriers that restrict them from completing their detox in hospitals. So we have to look at it on both sides. So by applying the behavioral, the health belief model, it is expected that awareness would increase on the serious health risk posed by incomplete detox and reduce perceived barriers by providing information on support and resources to these patients. So according to Simon and et al., patients who understand the health risk linked to discharge against medical advice are likely to complete detox in hospital. So they don't have the education and they don't have the awareness on what that entails and what the complications are when you live against medical advice in active withdrawal or in detox. So similarly, addressing perceived barriers such as stigma, job loss, or income issues, these concerns could significantly reduce against medical advice discharge. So we have to look at what the barriers are, addressing them that will help to reduce against medical advice discharges. So what is our campaign going to look like? We are going to use the title Recover Right, and it's designed specifically for the inpatient psychiatric hospital setting in Pierce County, low-income urban areas. So the key goal of the health campaign will be to decrease the high rates of against medical advice discharges among alcohol detox patients by addressing the risk factors identified through the health belief model. So the campaign would require a mix of different patient engagement, staff training, and the educational materials to create more informative and supportive environment for patients undergoing alcohol detox. So our key components of the healthcare campaign will include patient education sessions, informative materials, staff training and programs, peer support initiative to share experiences and offer encouragement to finish your detox. So they have to have that peer support. So we're going to use two multimedia approaches. The first one will be the poster. So the poster, we're going to utilize a poster which would make significant contributions in reducing against medical advice discharges among low-income urban communities in Pierce County. First, the poster can be used to remind health professionals the significance of considering language barriers and health literacy levels before we discharge alcohol detox patients, right? So secondly, it would acknowledge the importance of autonomy and independence, right? We're going to respect the patient's decisions and provide them with information that empowers them, that could build trust and understanding so they're making the informed decisions for themselves. Thirdly, the poster would emphasize the components of discharge instructions, right? So we'll talk about diagnosis, prognosis, follow-up, and of course, return to emergency rooms that are critical for continuity of care and patient safety. Then fourthly, it would provide guidelines to improve the discharge process of alcohol detox patients. So by providing discharge recommendations, the poster would serve as a framework and guide for healthcare providers to reduce against medical advice discharges. And then the second thing we're going to talk about, the approach we're going to use is going to be the brochures. So the brochures will be a backup, it will back up the poster and can be used to expand on the points briefly touched on the poster, right? So the brochure can raise awareness to the public and reinforce significance of proper discharge for healthcare professionals. The brochure can offer more detailed information on significance of monitored recovery and dangers of alcohol withdrawals. Secondly, it can delineate AMA courses to offer a better understanding on why patients might live against medical advice. And additionally, it would allow for a more comprehensive explanation on the legal and healthcare implications of living against medical advice. So in conclusion, right, recover right campaign. that targets high against medical advice rates among low income alcohol detox patients in Pierce County inpatient hospitals. So we're going to be drawing on that health belief model. The campaign can be used to reduce perceived barriers to providing supportive information and awareness of the serious health risks of incomplete detox. So our key initiatives of the campaign would include the patient education, like we talked about, sessions, the distribution of brochures and posters, and the promotion of peer support networks that encourage completion of detox. So posters and brochures will be critical since they will serve as a reminder to health professionals to consider health literacy and language barriers when discharging patients. Thank you for your time, and any questions, here are my references, and have a wonderful day.